your presenter today. As soon as I can share my screen, I will do that. There we go. Thank you.
You're all set, Gail.
Okay, thank you. Okay. So I just want to give you a little bit of background on how we determine what topics that we are going to present to you. We do it several ways. We might get asked to present something to you, or as we round, we identify questions and issues, and our team meets every Friday to discuss those issues, and that's where we come up with topics for these WebExes. So the one we're going to do today, I hope you guys can see my screen, it's called Patient-Entered Questionnaires. We get a lot of questions about that, so I'm just going to very quickly run through this with you. There are several patient questionnaires that patients can enter from my chart, but the ones I'm going to discuss today are the HPI and the review of systems. So as you know, patients can complete questionnaires through my chart. They can complete portions of their HPI and review of systems before they even come in for their appointment. After a patient has completed that questionnaire, you can review the information, you can review the patient's answers, and choose whether you want to include those patient answers in your open note or not. So once you get into an encounter, you don't even have to open up a note to see that there is patient information available. So once you get into an encounter, you can see right here, patient answers are available. You can see that they're there, but to apply them, you actually have to create a note and get your HPI and your review of systems buttons. So once you've done that, and what I did on this screenshot is I just created a standard office visit, which now allows me to have my HPI and review of system buttons. You can see that patients' answers are available, as well as once you open up the note, it tells you exactly where the patient has put answers for you to be able to view. So to apply these answers, you have to actually open the HPI and the review of systems. It won't happen from right here. So once you click on it, you will, they will automatically apply into your HPI or your review of systems, and you can tell that they came from patient questionnaires because they have the lines through them. So that lets you know that they came from something that the patient has sent to you. If you don't want to use these answers, you don't have to. You see where it says clear answers? If you click on clear answers, then it will clear out all of your answers. As you can see, the HPI goes away. But also I wanted to point out that up here at the top, you can always apply them again if you want to. So even though you've cleared them out, they're still available for you to apply at a later time or at a later date. So again, these answers can be removed, all the answers can be removed, and then once they still hang out there so that you can apply them again. This one is the review of systems, so it works the same way. Once you click on review of systems, they automatically populate in. You know that because they have the lines through them. Again, you can clear out your answers if you want to, and then you can add them back in at any time during any note as well. So the next thing I want to show you is how can you view them. So if you're a provider, an MA, or a nurse, there's a couple of places you can do it. You might get an in-basket message that lets you know that a questionnaire has been filled out, but you can also view them from the schedule. So you can add questionnaire to your report toolbar, and they're very easily viewable from that point. So if you remember from training, this is your report toolbar where you can add and take away whatever reports you want to see, and you can add this questionnaire one to it, and then when you click on it, you will see the questionnaire with the answers. And so in order to do that, remember from training, and I've told you numerous times during our quick wins, that the wrench allows you to customize something. It allows you to make it your own. It won't affect anybody else. And so if you click on that wrench and search out questionnaire and apply it, it will now be a button. And if anybody needs help with that, you can just reach out to me and I will walk you through it. It's very simple to do. But you'll now have this questionnaire button, and anytime you want to look to see if a questionnaire has been filled out, you can just click on this. If one has been filled out, it'll be in there. If it hasn't, it'll say no questionnaires that you can view. Another place that medical assistants, nurses, and providers can see it is you can view it from chart review. So when you open up your chart review, you'll go into the notes section. And remember from a previous quick wins that if you want to see my chart historical data, you can go to this patient message review. And once you click on that, it will pull up, and I just took a little snag of this, but it'll pull up all the my chart information that's in there. Anything you sent to the patient, anything the patient sent to you, it's all listed there. But you can see on 9/19 at 6:36 a.m., this patient submitted a questionnaire. And so if you look, it's a blue hyperlink, and most of the time in Epic, blue hyperlinks will take you somewhere. So if you click on the questionnaire submission, you will be able to view it with the answers there as well. So there's several places that you can go to view it. The next thing is from the PSR standpoint. So let's say I check in, you give me a review systems sheet to fill out, and I tell you that I have already filled that out and that I did it online. So how can the PSR confirm that that information is in there before the patient gets back to the back without one? So to view if a patient has filled out a questionnaire, on the PSR side, you can double-click on the patient's appointment either from the appointment desk or the DAR. It works from both areas. Once you double-click on it, this should be a familiar screen for you. You will see this screen, and you can tell that I have scrolled all the way down to the bottom, and you can see right here, patient entered questionnaire information, and you can see completed. So that lets you know that, yes, I did complete that. Just a couple of things you might see as a PSR is in that same section, you might see assigned. That means that it has been assigned to me, but that I have not completed it and returned it back. And another thing you might see is that there has not been one assigned. So you want to look for that completed information to know that I have completed it and sent it back. So that's all I have for you on that. We'll go into more questionnaires at another time. Now I'm so excited to show you a glimpse, kind of at a glance, of 2018 upgrades. So I want to let you know that what I'm going to show you, some of your providers have already seen it, but I'm going to actually do a little demo to show you as well. But what I'm showing you today is pretty much back office. There are some changes to the Cadence side, but what I'm just going to touch on today is MA, nurse, and provider changes just right off the bat here. So 2018 upgrade is coming. I'm going to give you a little information. It will be Friday. Our go-live date is Friday, November the 10th. All of your training is going to be done online, and you'll do them with e-learnings. And so you'll need to make sure you have your one-team login. And at the end of this, I'll tell you what your login is. The training will actually start October the 15th. You'll have access to it at that time. It takes, give or take, about an hour to go through your e-learnings. You'll receive an email link to the e-learnings, so you'll want to make sure and check your email. So I'm going to start right off the bat with the schedule. So the schedule looks a lot different than what we're used to, but in a million better ways. So a couple things you'll notice right off the bat is that the columns are taller, your rows are taller, and they did that so that we could accommodate a patient photo. This will help you to match up user names and faces, which will improve patient safety and quality of care. So you can see that the patient's pictures are there. Also, you'll notice right here we have some color coding that will tell you the patient's status. So it will let you know if the patient has been scheduled, arrived, if there's rooming in progress, if they're waiting for the provider. There's several options for them, and they're all color coded, and this will identify right by looking at the schedule where they stand on the status. Another thing you can do is you see these colors along the left. So if if Sydney has arrived and now she is waiting for the provider, you can click this color. You left click on the color, and you can change it to rooming in progress color, waiting color, visit in progress color, visit complete color. You can change it to just track your patient, so that is going to be really nice. You'll notice this column here is blank. It has nothing in it, and it is for your normal color dots. They're still available. They're still there. You can still use them, but now you can accommodate them. You can use them to communicate other information to clinical staff. So now you'll have those colors freed up a little bit, not all of them. You still want to keep your blue one like it is, but you'll be able to communicate different things as well. So back to the schedule. You'll also notice rings around the patient's photos. As you can see, there are colored rings around the photos. And this is a visual representation of the timing of the appointment. So you can see that this patient has a ring from noon to 3. That means that this appointment is a 15-minute appointment. If it was a 30-minute, it would go all the way half around from noon to 6. And then if it was an hour appointment, it would be a full circle. So just at a glance, you can tell the timing of that appointment, the length of that appointment is what I'm trying to say. Another thing you can do is hover over the picture of the patient, and it will actually say the appointment time as well as the length if you prefer to look at it that way. Another thing that I like is that it has column blocks that group related information together. So such as the patient name, the photo of the patient, the age, and the gender. And if you remember in our 2017 version, you had to scroll to get all that information, or you had to set up your columns just right. Now they have it all in one nice little column. So that will be nice when you're looking at things. You can have some information at your fingertips. So the next thing I'm going to show you, and my Epic timed out, so give me a second to log in. I'm going to show you a couple of things that I am really excited about. This won't take but just a second. I needed to refresh it, and I didn't, so that's my fault. But here we are. So I'm going to log in as an internal medicine provider. And let's go here. I'm going to change my department. I'm going to go to AHS Primary Care, make sure I have the right department, continue through my message of the day. And I'm going to look at that later. So this is in a training environment, so it doesn't have the pictures like the other one did. But this is your schedule. You can see your card messages that are attached to your in-basket are still here, so not a whole lot has changed other than just the look of the schedule. I'm going to double-click into our Fred patient, and I want to introduce you to the Visit taskbar. So you know how you used to have to go into plans and meds and orders to place any kind of order? Well, now down here at the bottom of your screen is the Visit taskbar. So this is where you can place an order, you can modify an order, you can pin and sign new orders. As you can see, you can print your AVS and you can sign your visit from here. This toolbar doesn't go away. So if I want to go into chart review and look at some things and I want to come down here and place an order, it always stays down here. So that's a nice thing so that you can review the chart before you make decisions on what you want to do. Also, meds and orders is still here so that nurses can do patient-reported meds. They can also queue up your meds, edit, ask for refills, that kind of thing, reorder meds. But I'm going to go ahead and show you how to place an order. Oh, they can also add the pharmacy down here. I always like to point this out so that we make sure we get our pharmacies. So one of the things I like about the Visit taskbar is that when you're placing orders, you don't have to, remember in 2017 you had to find the unsigned orders, are they all the way down at the bottom, are they all the way up at the top? Well, with 2018, it queues them up for you. So I'm going to show you how that works. So I'm going to order a CBC, just like always. Anything that you would have ordered in Meds and Orders, you'll order right here. So I'm going to order a CBC. I'm just going to double click on that. And when I do, you notice that I don't have to scroll to find it. It's right there. I'm also going to order a chest x-ray. This is where you would order you would place referrals. Anything that you order in Meds and Orders is done right here. And then I'm going to do a pulmonary function test as well. And I'm going to say I want it with a bronchodilator. So now all of my things that I ordered are right here. I don't have to scroll at all to find them. You will go ahead and click into them. So I'm going to say that my CBC, I want to make that clinic collect, and I just accept that. And everything else is the way that I want it. So now I could sign my orders right here, and I'll show you how you can still view them. But before I leave this section right here, I want to show you something you're going to be really excited about. So you can add a diagnosis here, you can edit multiple, you can get an estimate, but see where it says options? One of the things you can do in 2018 is create a panel. So if every patient I have that has asthma, that comes in with asthma issues, if I order these three things on every single asthmatic patient that walks through the door having trouble, I can make a panel. So I go down to options, and I'm going to create a panel. I can add everything to my panel. If I don't want to do the pulmonary function test every time, I can take it out. I can add medications into this panel. I can do anything I want to in this panel. So I'm going to name this panel Asthma Panel. And I'm going to have it go to my favorites. You can choose where you want it to reside. And so I'm going to accept it. I don't want to apply it to this one. And so now I have created a panel. I'm ready to, for this patient, I'm just going to sign my orders. And one thing that's new here, you'll see, is normally all you had was to add a diagnosis, and if you hadn't already added one in your plan, it would be empty, and you'd have to add one from here. What's new in 2018 is that now you can add a diagnosis from your problem list. So if your problem list is kept up, you can click on here, and if there was an asthma, I could just pick it and be done with it, but there isn't one, so I'm going to go ahead and search out an asthma diagnosis real quick. And remember, if you have several things that need the same diagnosis code, you can click all three boxes, or you can just click the diagnosis and it will put a check in all those boxes. I'm going to accept that. And this is just an error we get in the training environment. And so now I have signed my orders without having to scroll around. And if I ever want to look at them again, they are right here. So you can see this clipboard. I click on it, and it now shows you that my orders are signed. It shows you my orders. I can print them from here, or if I want to take one out, I can do that from here as well. So that is a nice thing. Now I'm going to go back to my schedule because I want to show you how you can use your panel. So I'm going to pick a new patient. We'll pick Felipe. And I'm going to go ahead and exit out of his express lane. And so now I want to order something for, let's just say Felipe has come in, he's having trouble with his asthma. I can hover over this and open my preference list directly from here, or I can click on my green plus mark. I'm going to go ahead and open it from here. This will pull up a familiar screen, which is your browse screen. I'm going to click Only Favorites. There is my asthma panel. I'm going to click it, and if you remember in 2017, you had to click every portion of the panel. Now I just say this is the panel I want. I accept that. It wants to know on the PFT, do I want it with or without? So I'm going to say I want it with. That's the only adjustment that I have to make. There is the panel I created, and I can just sign that panel from here. I can add a diagnosis, and that panel drops. So that is really, really nice and will save you a lot of time as well. I want to show you one other thing. Let me go back into Felipe because I haven't signed his orders. So under options, that's where you went to make your panel. There's a few other things that are new and fun under this options that'll save you some time and some clicks. Providers, so if an MA or a nurse has placed any of your orders, they can go in and put an authorizing provider from here. You can CC your results, so I can click on this and I can say, if I want Dr. Thomason to get all of these results, I can just put his name right in here, or if just for some reason I only want him to get the chest x-ray result, I can unclick everything and make sure that he will get a copy of those results as well. Another thing in here is interactions. Had I prescribed a medication, I could click right here to see, is it going to interact with any medications that the patient is already taking? I can route it to somebody as well. And this financial one shows you an estimated price, the patient amount, and an adjustment, the adjustment made as well. A couple of other things that I'm going to show you. I am going to order a med, and this is going to be really nice as well. So I'm going to order 20 milligrams of prednisone, and I'm going to go into here so that I can make the prescription the way that I want it for the patient. And a couple of new things are you can taper and ramp a dose now, as well as do a combination dose. So you can do custom dosing. You can do complex medication dosing. You can combine different doses over a single period, and you can do different AM and PM doses. You can do different doses for different days of the week. You can combine scheduled doses with PRN doses. So that is really going to be nice, and that will save you some clicks as well. So now I'm going to show you, because I have just a few minutes, I'm going to get out of this. It's not wanting me to get out. I'm going to show you when you go to your wrap-up now, I can go to review. And if you remember, in the 2017, you could only mark 2 or 3 things as reviewed, but now they're in here. You can mark your allergies, your problem list, all of your history, medication, tobacco history. You can mark all of that as reviewed with one easy check mark. So that'll be beneficial to you as well. So I have now completed just an at-the-glance look at 2018. It has a lot of exciting things in it, and I know that you guys are going to love some of those things. So just as a reminder, we will go live with this on Friday, November 10th, and I told you all of the training will be online through e-learnings. So you need to know your One Team login, and that is corporate / and then however you log into the system. So mine is corporate / G York, and then you'll put in your password. So make sure you have that handy. Training starts October the 15th. It'll take about an hour to do the e-learning training. You'll receive an email. Link to the e-learning, and you can check your email for that as well. So that is all I have. So I guess that's it, Verda. Thank you for your time. I appreciate all of your time, and I hope you enjoyed it and learned some things from it. Thank you very much.
Gail, we'll look forward to hearing more about those great features in 2018 soon. Thanks a lot, guys.
Thank you.